The first exercise we're going to complete is the warm-up on the bike. Immediately post-op, you might not have full range of motion, so you're going to try to do half circles. You want to hold it at the very end range there for a small determined amount of time, just so you get a little bit of a stretch. It's going to promote some joint lubrication and increase blood flow to the muscles. And we'll try to warm up for about 10 minutes. And if you're in a pre-hab situation, just go ahead and ride the bike like normal. 5 to 10 minutes. The next exercise will be the quad set, where you just tighten the top muscle that's on your thigh. You're going to want to try to straighten your knee as best as you can. So you're going to try to reduce the space that's right underneath that popliteal fossa. You're going to try to do this for roughly 30 repetitions. And then eventually you'd like to try to get 3 sets of 30. Okay, now the next step in this progression is you're going to be doing a quad set with a straight leg raise. So you do the quad set and just lift that leg up. Try to lift that no higher than like 12 inches off, 12 to 16 inches off the table. Good, and again, all these are going to be 30 sets of 30 eventually. Try to get 30 at first. Now we're going to be doing this in all 4 planes. So this one's hip flexion. The next one will be on your right side. So of course the exercise, or the leg that we're working on, is the surgical one. So again, we do that quad set again, and then we do a hip abduction. So you just lift up again. Again, no higher than 16 inches. It's important to get that quad contraction first and then lift. Looks good. Now we'll lie on our stomach and do the same thing. Quad set, lift. Quad set, lift, and when you're up in the air, you try to hold it a second, and then you relax it. So it's a nice, slow contraction all the way around. Okay, now we'll lie on the effective side. In whatever position you want to do, you can put your top leg on the bottom or on top. So what you're going to do is you're just going to do that quad contraction again, and then lift up with that affected leg. Good. Now, other ways to do this, if you can't hold your leg up in the air like that, is to bend your right knee and put it in front or behind your leg. And then do that again. Whatever you have range of motion for in your hips. Good. Now, after you have all this done, you'll go ahead and lie on your back. And now we'll do a heel slide. So you want to slide up so you have heel contact. And we're going to work on the heels, we're going to work on the hamstrings now. So you just slide that heel up to your butt and slide and back out. This is going to be a range of motion exercise. Also, you're going to be working on hamstring strengthening, because you're going to want to think about contracting your hamstrings and then sliding your heel back. Another thing you want to watch for is trying to keep that knee in nice alignment. Don't let it go in like this, and don't let it go out like that. Perfect. Yep. You just want to keep it straight over the hip. Very good. Okay, now what we'll work on is another quad exercise. This will be a short arc quad. Go ahead and put the towel underneath your knee. So you want maybe, a 15, 20 degree bend in that knee like that, and then you just want to try to kick that knee out straight, nice and easily. Yep, perfect. Again, trying to make sure that knees go straight over, the toes go straight over the knee. Good. Okay, the next exercise we'll perform is a hook lying bridge. You're going to be lying on your back with your knees bent, and you're just going to squeeze your bum together and then lift your bum off the table. And you're going to slowly lower down. This is mainly working on your hamstrings and your glute muscles, especially when you fire the glutes when you squeeze your bottom together. Also, it's going to be working on a little bit of knee control and range of motion. It's going to be difficult to do this post-op because you may not have enough range of motion to get into this position. Try to get about 30 repetitions here. The next exercise will be a front step up. Go ahead and come up on the stair. This is about a 4-inch stair. You might want to start in a smaller step, especially for a total knee replacement, because you're going to have a lot of bone-on-bone pain. So you can see, put yourself between two tables so you can hold on as much as you need to. Go ahead and go back down, and keep that effective leg up there the entire time. Go ahead and come back up. Now, go ahead and go back down. As you notice with her knee, she's maintaining the knee over the toes with alignment-wise, and the wrong way to do this would be to keep your knee in the medial or lateral side. So do not let that knee go in like that or go out. Okay. The other key component is not letting the knees go over the toes. So when doing this, make sure that knee is nice and behind the toes. Okay. And the wrong way to do this would be letting that toe come over. So go ahead and show us that one. The knee over the toe. It's too much range of motion for this exercise. Okay, good. Now the next functional activity here is going to be acting like you're sitting down in a chair. So you're going to just almost do a mini squat. So go ahead and squat down slightly, right there. And as you can see, I'll draw back a little bit. You can hold on to the sides as much as you want and then come back up. So it's just a slow and controlled motion. Go ahead and go down and slowly come back up. Again, same rules apply. Not letting those knees go anywhere but straight over those toes. And the other idea here is letting the knees not go in front of the toes as well. That way you maximally protect the joint. The next exercise we're going to perform is a calf raise. So you can use any hand support that you need and just go ahead and lift up your heels. Perfect. Like all the other exercises, complete 30 repetitions. Now after you got this one down, go ahead and we're going to do a hamstring curl. So you're going to try to take your heel to your bottom. Yep, and back down. Again, you're going to repeat this 30 times. Great. Now the next one we'll do a standing balance, and this one's going to be called a 5-way hip. So you're going to be standing, we'll do this both legs, one at a time, of course. So you're going to stand on one leg in a balanced position. So go ahead and stand on one leg. And now you'll do hip abduction with that leg. Sorry, we have flexion, abduction, extension. Go ahead and do all three. Do flexion, abduction, and then extension, and do some horizontal adduction, come across, and then go behind the other leg. Yep. So then you do that all repeated again. You go flexion, abduction, extension, front, and behind. So now we're going to work on some lunges, another good functional activity. So you're just going to lightly come back up, and you're going to slowly bend down. Okay, again, keeping your knees straight over the toes, just like before. Yep. And now you're going to again do about 30 reps on one side, not very deep, and then do switch. Yeah, I'll go ahead and switch up, and we'll do 30 with the other leg in front. Perfect. Okay, good. Everything, make sure, is maintained in a pain-free range of motion, especially with that bone-on-bone. You don't want to cause any more increase in pain, such as increase inflammation. The next exercise we're going to be completing is called the long arc quad. You're going to slowly kick your leg out, hold that out there about a half second, and slowly lower down. Just like the other exercises, complete 30 repetitions. The next exercise you're going to be completing is the tibia femoral distraction. The tibia is going to be pulling down on the femur, thus stretching out the muscles in the capsule of the knee joint and relieving any joint pain. Basically a nice, relaxing, and slow kick back and forth, just letting gravity do its thing.